As we see this virus spread around the world, less and less will it be about borders, and more will it be about what communities are doing themselves to protect citizens and prevent the spread of the disease.
As the number of confirmed cases of coronavirus continues to rise around the world, the Prime Minister won't say if his government will close Canadian borders to mitigate the spread. The United States and Australia have already banned foreigners arriving from impacted countries like China and Iran. But so far, the Canadian government says the best approach is for people to take precautions, like monitoring travel advisories, following the advice of their local health authorities, and regularly washing their hands. Also, authorities are suggesting Canadians avoid body contact, hugging, kissing, shaking hands. Sad. Officials are also relying on Canadians to self-isolate if they're returning from China's Hubei province or Iran. So is the government doing enough to keep you safe, or should it follow the approach of its allies? Let's bring in opposition MPs to find out. Matt Jeneroux is the Conservative health critic, and Laurel is an NDP MP from British Columbia. Hello to both of you. Matt Jeneroux, let me start with you. Do you think it's time for Canada to close itself off from travelers arriving from places where the disease is widespread?
Well, thanks for having me on, Joyce. I think what we all know that this virus knows no borders. However, what we don't know, though, is what the possible outbreak pandemic plan is from this government. So our critique wouldn't necessarily be do all the things that you mentioned. It would be tell us what your plan is, so then more Canadians know what that means. So, for example, a more rigorous screening process at the borders, mandatory self-quarantine. If you're traveling from one of these countries, potentially shutting down flights ingoing and outgoing from these countries as well, are all things I think that are on the table. But without knowing what the pandemic plan is, really leaves us as an opposition at a disadvantage as to what are the most effective ways to control this virus.
Laurel, I'm curious, about what the NDP's position is on that. Is it time to close the border to travelers who are coming from, sort of crisis areas?
We want to make sure that there are thorough screening processes at the borders. This is a rapidly evolving situation. So what we need is clear, measured communication from our government about what the plan is, what concrete actions they're taking. Having our health minister tell Canadians to stockpile supplies, and then a few days later for the government to say they've got it kind of under control, they're forming a cabinet committee. Canadians are concerned, and they want to know that our government has a plan to address this if it does actually become a larger outbreak. And we need to know that there are going to be provisions also put in place for workers who are impacted. We know that the government has asked folks to self-isolate. For people who don't have paid sick leave, it makes it very difficult. In order for us to actually support the Canadians who are going to be impacted by this and make sure they can make the responsible choice to stay home, we need a concrete plan that protects workers, that supports Canadians, and really gives us up-to-date information about what's happening on the ground.
Because we do hear reassuring words from the government, but not many specifics on budgets, for instance, cost or strategy. The U.S. this week, for example, announced an $8.3 billion contingency fund for coronavirus. In Britain, the government has issued a 27-page document, a preparedness plan. Does the government here need to be, and I hear from both of you that they do, but what specifics, Matt, would you like to see or hear from the government?
Yeah, just to correct the record a little bit, I don't believe that the minister actually said stockpile. However, that was what the headlines came out as, is that we now see more masks going off the shelves in Edmonton here. Hand sanitizer it's hard to find. Toilet paper at the local Costco's. All of these things are as a result of what the minister has said, but ultimately didn't say either. So they've struck a cabinet committee, which we certainly welcome. However, it took them 6 weeks from the first confirmed case in Canada. You look back at the H1N1 virus in 2009, there was a daily briefings provided to the opposition at the time under the Conservative government shortly after the first case in January 2009. So without being able to have that information, and it really does seem that this government is keeping it somewhat secret and a secretive approach to what their actual plan is, which some could question, well, perhaps they don't have a plan then, which I would like to think that's not the case. However, if this is, if we're being left in the dark as opposition and quite frankly as Canadians, I think there's a lot of questions that are going unanswered right now.
Laurel, provincial health authorities, do you think they're prepared if the virus reaches a pandemic level? We have an uneven healthcare system across this country. There are some remote areas, Indigenous and Inuit communities are not well served by our system. What would you do for them?
I mean, I think my Conservative colleague mentioned the H1N1 event, and that disproportionately impacted Indigenous communities. As a start, I would like to see the Indigenous Services, a representative for Indigenous Services on the Cabinet Committee. The fact that was omitted, I think, is kind of a glaring error. And then, we want to make sure that our healthcare professionals are also supported. We need federal safety protocols that are going to protect our healthcare workers so that they can protect us.
That's unfortunately all the time we have. Thank you, Matt Jeneroux and Laurel Collins.